Great. Thank you so much. Well, good afternoon, everyone. Happy New Year. Welcome to Trust for America's Health's Age-Friendly Public Health Systems, or AFPHS, monthly training series. We're happy you're here to join us today for the first session of 2024 to learn more about how the public health sector and partners can support older adult health and well-being. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Karan Phillips. We lead the AFPHS movement, which would not be possible without the generous support from and partnership with our friends at the John A. Hartford Foundation. Next slide, please. So we do ask that you keep your devices muted during the presentation today, but feel free to put your questions in the chat throughout the session, and we'll have time for discussion at the end. Next slide. So as most of you know, TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person, individual, and community. TIFA produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness, and our Pain in the Nation report series, which is on the epidemics of alcohol, drug, and suicide deaths. Related to healthy aging, we have produced reports on a few topics and more on the way, including housing and rural healthy aging. Next slide, please. This year, our trainings will focus on equity in healthy aging, and we hope to provide guidance on addressing equity for older adults, caregivers, families, and all who serve and provide for older adults. We're selecting topics and speakers who will provide examples, resources, and innovations on the public health roles in equitable healthy aging. We are continuing to learn about the cumulative impact of poverty and structural racism on health, and how the negative effects of these factors, if left unaddressed, can further challenge the health and well-being as we age. So to kick us off, and like all our January trainings, today's session is on ageism. So next slide. And we're pleased to welcome for the fourth year, I think, Trish, it's the fourth year in a row, our colleague, Trish D'Antonio from the National Center to Reframe Aging. So Trish, I'll turn to you now. Thank you so much for being here.
So it's my pleasure to be here, and I am going to share my screen. If you'll just bear with me, I've learned when I give these presentations, it's best not to start talking until I know our presentation's live. And Megan, can you confirm that you're not seeing my presentation version, you're seeing the actual slide, right?
I'm seeing the actual presentation, yes. Good job.
All right. So after 4 years, here's what we got it. So welcome, everybody. I'm so pleased to be here. I'm Trish D'Antonio. I serve as Vice President of Policy and Professional Affairs for the Gerontological Society of America, who leads the National Center to Reframe Aging on behalf of 10 national organizations. And it's always a pleasure to work with colleagues like Megan and like Karan, because we're all really excited and passionate about this work, and always trying to figure out ways that our work intersects and how we can continue to work together to advance all of this important work. So really pleased to be here. And let me just make sure I advance the slide. That's the one thing I didn't check. Okay, good. So the first thing I'd like to do, if you all wouldn't mind, if you would chat in the answer. If you are a member, if you would say yes to this question, are you part of the aging population? Either chat in the word yes, or if you could, using the reaction button, use that little celebration button. Are you a member of the aging population? Okay, I'm seeing lots of yeses coming in here. No, okay. Yes, okay. So as we're starting to see, I'm alive, so yes, thank you, Julia. So I hope by the end of this presentation, we would all see that we are all members of the aging population, because we're all aging. So that is what we're trying to convey here, right? A better, improved understanding of aging. And what it means to age, and how we all see ourselves in aging. So the National Center to Reframe Aging was established in 2021 And for the last few years, this is based on the work that we've done in the Reframing Aging Initiative. So the Reframing Aging Initiative has grown to the point where we are a national center. And our goal is, we're dedicated to ending ageism through advancing an equitable and complete story of aging in America. This is evidence-based work that we have done. We house some of the trusted sources for the proven communication strategies you can incorporate in your work to help frame aging issues, to help frame aging, to ultimately get us to understand in society the importance of understanding the contributions of older people in society and to counter ageism. So when I mentioned when we first started, I said, we're part of a consortium of 10 aging organizations. And how this got started was about 10 years ago, the executive directors of these organizations got together and said, what is holding us back? What is preventing us from advancing policy? What's preventing us from really getting people to understand what it is we do? Because if you look at these organizations, we all have similar missions to advance, whether we're professional membership organizations or we are consumer-related organizations or we represent philanthropy. Ultimately, we all get together around aging. And so what we felt was that ageism was starting to get in the way. So when it came time for certain policies to pass, we would think that a bill, you go to sleep at midnight and you think, okay, we got the funding, we got the strategy, we've got the policy in place. And then the next morning you wake up and you find out, oh, in negotiation, this is the piece that came out. And it usually has something to do with older people and older adults. So it was really important for these organizations to get together and say, let's figure out what it is and how we can counter these messages to advance policy and practice. We're funded by the National Center is funded by 4 philanthropies: the John A. Hartford Foundation, RRF Foundation for Aging, the SCAN Foundation, and the Archstone Foundation. Some of the organizations that we work with locally and regionally have also found partners who are local and regional funders who have supported work in specific communities. And then the other piece that I'd want to share with you for you to know is that our research partner in this endeavor is the Frameworks Institute. If you haven't heard of the Frameworks Institute, they are a nonprofit think tank. They conduct social science research to help develop communication strategies in many areas. So one other area that you may have heard, there's some work that's been done in how we think about care in nursing homes. How can we communicate about that? They've done work in childhood toxic stress and worked with the Harvard Center on the Developing Child. They've done work in immunization and vaccination. And worked with the American Academy of Pediatrics. How can we communicate about vaccinations to increase understanding about the importance there? And I think the other important thing for you to know about the Frameworks Institute is that they work solely with nonprofit organizations. So before we really dive into what it means to frame your messages and your communication strategies, I want to be sure that we're all we're thinking about ageism and we're talking about that in the same way. So the World Health Organization has done a report and outlined ageism in several forms, right? So they're the stereotypes, prejudices, and discriminations directed toward people based on age. So notice I didn't say there's based on older people here. It really does. There's an impact across the life course with ageism. And you think about it existing on multiple levels here, right? So that interpersonal ageism that arises from interactions between 2 or more individuals, right? You can't do this, you're too young. You can't do this, you're too old. You hear it when in the news a couple months ago, we heard, how does a 21-year-old have access to top secret information? And that case, when you think about it, it's not that person was 21. There's other things that we need to think about that surround that person and why maybe they should not have had that access to that information. It certainly wasn't chronological age. Other things to think about: compassionate ageism. How many times have we heard, "Oh, you're so cute, you don't look 60, you look 40." Or, "Oh, sweetie," or, "Oh, dearie," when we're talking to an older person, right? That totally eliminates their self-actualization, right? Institutional ageism. We know that there are institutions that have forced retirement ages. We know that there might be some systemic practices in institutions say, well, we don't promote anybody until they're at least 25 years of age. Now, you're not going to see that in writing anywhere, but you can tell in culture. Same thing as what we see where people experience age discrimination who are 50 and older around promotions for jobs, right? And then there's that self-directed ageism that we all may experience. And this one, we really have to take to heart and we have to think about, because I find myself every once in a while, I lost my keys, I'm having a senior moment. Well, that's not really the case. I have a pain in my back. It must be because I'm getting older. And there is research that shows people delay seeking treatment because they believe it to be solely because of age. And so it's really important that we're out there making sure that people understand that this is not solely because of age. And this ageism, it starts in childhood, and there are messages that we receive. There are ways that it's reinforced over time in culture. If you look at the title of the presentation today, it's a generation's work, because really we're working to change culture and some deeply rooted and deep-seated understandings that we sort of need to we need to break people's habits and thoughts about this. So a couple of years ago, our colleagues at the University of Michigan conducted a poll and asked about experiences of everyday ageism. And it's a really great report to look at if you haven't had a chance to see this. And note that 82% of people interviewed age 50 to 80 experienced one or more forms of ageism every day in their day-to-day lives. So just think about what that means, including that internalized ageism that I talked about. And so, like, seeing those messages, what does that start to reinforce? Death, decline, and disability when we're older people. And that's really where we need to really get people to think beyond those messages. And we can do that with our communication strategies. So ageism results in many places: personal, professional, and think about how we hear and see those messages throughout our lives. So it's the jokes we've heard from other, from family members, friends, colleagues about aging. It's characters we see on TV and how they're portrayed, right? Older person who's deaf and making fun of that, as opposed to recognizing the importance of assistive devices, right? If we have a hearing aid, we know how that contributes to so much more about our health, preventing social isolation, making sure, there's even the research around hearing and cognitive impairment. So think about all of those things that come into play here. We see it in advertisements, right? We hear it right now in political discourse, right? Oh, he's too old to run for office. Oh, she's too old to run for office, to be in office. And we hear she's too young to be in office and he's too young to be in office. And we have systems set up that prevent people based on age to be in an office. They seem like minor, and it seems like I'm getting a little picky here when I say, think about the birthday cards you send and you receive. But think about, where else would we make fun of someone in a way that perpetuates not only ageism that we see in this card, but we're making fun of someone's disability when you look at how the one woman is kind of hunched over in the picture. So, like, where else would we allow that to happen? And we really have to think about that. So I don't want it all to be the negative piece. I do think we have to level set about ageism, but there are things that we can do. And that's really what we're here to talk about today. Underlying our ageism is implicit bias. None of us wakes up in the morning and says, let me see how I can be ageist today. No, maybe somebody does, and that's okay, you don't have to share, but think about that. But there are some things that we contribute ourselves and that we found in our research that particularly people who work in aging were contributing to the picture, the cultural model that people develop based on what we say, what we write, how we think about this. And what we know is that this unconscious bias, right? This is what really influences our attitudes. It influences those mental models that we have about aging, and it's like a split-second decision that we make, right? But these implicit biases that we harbor, what we know is using well-framed, after we conducted this research, using the well-framed messages or the principles of communication in your messages and makes people aware of their implicit bias, we can see change. We can see how people start to and are more likely to think about aging and older people differently. So let me ask you, and you can chat in if you've had an experience, but have you seen ageism? Have you experienced it? I mean, that study from University of Michigan says many of us likely have. The one that you do not have to type in anything about, but I want you to reflect on is, have you perpetuated ageism? And I will tell you that the hardest thing that I thought about when I recognized this is I no longer send birthday cards that make fun of aging. I also have asked people not to send me birthday cards that make fun of aging. And in my family, that's really tough because the challenge is to find a funny birthday card for people, right? And so looking at that, it's really important that we continue to advocate for those types of messages that we know will recognize our momentum and our experience and recognize us aging without poking fun at it. And hopefully today you come away with some ideas about what you can do about it and see how you are part of the ecosystem for well-framed messages about aging, to reframe aging. And it happens personally and it happens professionally, right? This is how we get the change that we seek. So we recognize that you're part of this network. We believe you're a part of this network. And today in this presentation, start to reflect on where you see yourself in this network to help improve how the public perceives older people and aging. So the other thing that I think is important for us before we get to some of the traps to avoid and the strategies to advance is why framing matters. And we're going to talk about a couple of things here today that are critical parts of social change. And one thing that I all want us to recognize is we all frame, right? We are communicators we are communicators. Don't even have to, that's just the way to think about that. And it doesn't have to be in your professional job title, right? We're all communicating. And we have to think about those choices that we are making all the time when we're communicating at work, in professional settings, when we're communicating in personal settings. And really thinking about how we're not driving people to, or how we're driving people to where we want to be. We're not driving people to an unproductive model of what we want to do or what we want to accomplish is important. And when we do that, we think about, what needs to be intentional and deliberate in our message, right? So what to emphasize, how to explain it, and most importantly, what to leave unsaid. And an example that I often share with everyone is when I want to, think about where we're going on vacation, and I want to talk to my husband about that, right? What am I going to emphasize for the location that we're going? Well, he really likes museums. And he's a real history buff. So anything that we can do related to that, I'm going to emphasize those pieces. I'm not going to emphasize the shopping that I'm going to get to do because he's not really a shopper. I'm going to explain it to him by showing him all the easy ways that we can get to these different places. Some of them may be discounted costs or because we buy a package, things like that. The one thing I will definitely leave unsaid with my husband is that as we drive there for 4 hours, we're likely going to experience a lot of traffic because he hates traffic, right? So think about it. We all frame every different way, and we know that our colleagues and our families and our friends are framing to us all the time as well. What our goal is here is that how can we change those mental models that people think about, particularly around aging, particularly around older people, with the work of the National Center to Reframe Aging. What we're trying to do is improve our communications that drives toward a different type of conversation, right? How can we get people to start talking about aging differently? And people will model what our work, the public will model our work, the public will model how we frame our messages, how we frame our reports, how we frame our web pages. Think about all that and how it starts to get somebody to start thinking like, oh yeah, not every older person that I know who's 72 years old is in a nursing home, right? There are many, we have to think about the many different ways and how different we become as we age, right? Some of us do have multiple chronic conditions, and some of us are out there continuing in a work setting. So it's really very different, and we're trying to get people to understand that broad dichotomy because we want to get practice and policy initiatives changed so that we support aging and older people across as we think about this across the life course. And one of the things that's important to realize in our research, conducting interviews, conducting focus groups, what we did and what Frameworks did was conduct some interviews to ask people in the aging field as well as members of the public, which let's not forget that people in the aging field are also members of the public, so it's not a perfect setting. But there's also, when you think about how do we approach aging, we all embrace it, right? We all think that there are great things that we can do to continue to support us all as we age, recognize that the bias that we have toward older people really is biased toward our future selves, right? Whereas the public battles it. And where do we hear that and see that? In some of the street interviews that we conducted, we actually see people like pushing away, right? Physically pushing away when they talk about aging. Or when they talk about older people, like the eyebrow goes up or the nose scrunches a little bit because, I'm not aging. This is not me. This is other people, right? The other thing that I think is really important here, and for time's sake, I'm not going to go into each one of these, but the one thing that I think is also important is that when asked how big of a concern is ageism is not on the public's mind. It's absent from thinking. Whereas, the initiation of this entire project came from recognizing that ageism was impacting how we could get policy support and practice support for older people. And so I think we really need to remember that it's not really on the public's mind. This research was conducted prior to COVID. I will say that in COVID, when we heard statements like, we will not treat people over the age of 65 simply because they were over the age of 65, not considering function and frailty in the discussion. There was a level of increase in why and how people thought about ageism and how these were ageist comments. The one thing I think we have to remember is that, so this research is based on the United States, so it was solely conducted in the United States. You couldn't really translate this to Japan, say. But, as Americans, we tend to have short-term memory. So as we start to move further away from the pandemic of COVID, we're not hearing as much about the ageism that we heard during the pandemic. And really what the challenge is what we found out in the research is we sort of have this, this comment about you say, they think. And you have to think about, and this is where we learned from a perspective as aging advocates, we weren't really getting the message out the way we thought we were. So in a group of people who work together and understand a comment, you're usually successful, right? So even using the term the elderly, which we really frown upon at this point, but using that term in a room, in a group of people who understand that, who are aging advocates, it's one thing. But when your message goes out, right, when it goes out to the public, you don't have the ability to control like those cultural models, those ways that people think in a split second. And what happens is you might be talking about that larger group of people. You're talking about a larger group of seniors, right? And you know who you're talking about because of the work that you're doing. But what you're cueing in the public, what you're cueing for people is to think about frailty and dependency, most likely. And that's hard to think about because that's not really what I thought I was doing when in my communication, but really that's the thing that happens. And what we learned in our work is the words matter. Now, words matter. What also matters is who is the community that you're speaking with and who is your audience. But when we asked our subject matter, our people who participated in these work groups and focus groups, we asked them, so tell me, if I use this term, who's the least competent and who's the most competent on a scale? Well, seniors were considered least competent when asking this question. Then you'd hear about really more the elderly than elder, and I'll talk about that in a second. Senior citizen, older person, older adult. And then we ask the question, how old is a senior, an elderly person, senior citizen, older person, or older adult? And you see there, what happened was, so ask a 22-year-old person, how old is an older adult, right? You start to get probably age groups that skew a little bit younger than we were really trying to address. So what you'll hear when we talk about some of the language, how we should reference people when we're talking about older people, is using the term older person or older people. We also recommend that if you are talking about a cohort of age 65 to 75, be specific. It's important to recognize that if we say people over the age of 65, we are actually now talking about an age cohort of close to 40 years. And where else would we describe an age cohort and expect everyone to be the same with a 40-year cohort, right? We would not expect that. When we talk about other age cohorts, we talk in much more specific ways, right? So what I would caution you here, and I referenced this in the beginning, is know your audience. Because the first question people say to me is, Trish, our project is called the National Senior or something or other, or the State Senior or something or other. Should I change the name? And what I would say to you is adopt the principles first, start to get your community to understand these principles, adopt this in your communication strategy. And what will happen is if you should change your name, if you should change the name of your organization or your project, that will start to come. Now, if you're starting from scratch and you have the opportunity, think a little bit more creatively because you don't want to drive people to thinking about somebody who's less competent, who's vulnerable all the time. And you don't want to drive somebody to think about the age cohort, the age group that you're trying to address. Does that make sense? I'm seeing some heads shaking. For those of you that are on, I can see heads shaking. So next, I want to just kind of start to move toward the strategies that we want to start to apply. So navigating this public understanding that I think is really important for us to think about. And what we learned in our research is what we call our traps to avoid and our strategies to advance. And really, you want to start to think about these in ways that we didn't, they're very subtle sometimes. It's really not something that that we think of in a way as like, oh, that doesn't really cause much harm. But really what it does is it drives people to say, let me work someplace else, or thinking solely around one way to think about older people. And so I'm gonna go through a little bit of this, but before I do, I want to show you a video that will help you understand this, and it's a little less than 2 minutes. So let me just get that started. And Megan, can you just give me a thumbs up if the volume's good? Okay, thank you.
Something happens when we talk about aging. We care deeply. We have the facts. Yet, our message often doesn't get through. Why? It could be the way we're communicating. Research from the Reframing Aging Initiative has
Oops.
identified some communication traps, common practices that undermine our message. These traps include fatalism, fantastic examples, and false starts. First, fatalism. Take the silver tsunami, an unfortunate metaphor for the growing number of older people. Yes, it's dramatic, but it also creates an overwhelming sense that nothing can be done. Instead, offer concrete solutions in your messaging, early and often. Next, fantastic examples, sometimes called super seniors. Yes, it's wonderful when older people do incredible things, but featuring extraordinary individuals can be misleading. Instead, try to keep your focus on better opportunities and realistic supports for everyone. Finally, false starts. We've all seen presentations that start with a statistic, like, by 2030, 1 in 5 Americans will be 65 or older. This doesn't begin to tell the whole story of aging, and it's pretty boring. Instead, start strong with a shared vision, like, staying connected to family and community is important to all of us. This is a more engaging way to start, and you can build your communication or story from there. Changing the way we talk can change attitudes about aging. Find resources and get started at reframingaging.org.
Oops, did I start it again? So there's a series of 4 videos that we've produced, and when I can, I'll put something in the chat while I'm sharing. It looks like it's stuck in my slides. But if you're thinking about how you can share this with colleagues, those videos are less than 2 minutes. And you can really get to some of the heart of the matter around strategies to advance and traps to avoid. That I think are really helpful. And when we think about those traps to avoid, the reason why you want to avoid these types of traps, individualism, right? Where we would say something, where you'd hear something like, if you only ate healthy your whole life, you wouldn't have this problem with your chronic conditions. Or if you only started saving for retirement at 22, you wouldn't have a problem with retiring right now. Those statements, those beliefs around individualism, I'm not saying that we shouldn't, take care of our health by exercising and eating well, but it doesn't take into effect access. Do we have sidewalks in our neighborhood to be able to walk safely? Do we have access to grocery stores in a way that is easy for us to get there? And so those social determinants that we need to really think about, social determinants of health and how that impacts us versus them. We often hear people talk about older people as other. So when we talk about, even someone who we've seen in some of our interviews, people who appear the age that we're talking about, talk about older people as they, right? When they get older, or I see that they do a lot of great things, running and hiking, really working in that. And I will tell you that the first trap that I started working on when I started trying to move forward with principles is I would write something out and then I would look about how I othered older people. Did I reference older people as they and them? And it's a real great way to get started. That ideal versus perceived real, where we sort of think about things about, one of the advantages of getting older is we relax more. We get to go on cruises, right? Or there's that perceived real where People think everybody is using a cane or a walker in order to be able to exist. And the important thing to think about that is assistive devices are important, right? We know that that's important. Having a hearing aid, being able to use a walker means that you can avoid some scenarios of social isolation, right? So think about that and how it impacts us. We talk about nostalgia. You start to hear people say things like, oh, back in my day, we never had this problem. And really, if you really looked at it, you probably did. You just weren't in a point where it impacted you the same way and you weren't thinking about it, right? Because remember, ageism is off people's radar screen. And the zero sum, that fatalism solutions, right? That really gets us into trouble too. What do you do when you see it, when you hear somebody talk about a tsunami, right? You run. When we start with statistics all the time, and this is one that I also think is an easy way. When we start with that statistic of by 2030, the percentage of people who be over the age of 65, already somebody's starting to say, well, it's 2024. What am I going to be able to do to make a difference here? I can't do anything here. Let me shift to something else that I can really make a difference. And so start to think about those things. And if we had some time and we connect throughout the year with the program, we go into this a little bit more in depth about some examples and some ways that you can start to really think about advancing this. What I want to do is kind of talk a little bit more about the strategies to advance, because it's important that we start with that systemic solution for people to think about, right? We want to talk more accurately and more completely about aging, right? How do we advance these kinds of communication strategies? And how do we advance these patterns of thinking? And it's really tough because our brains are wired to think about the traps more than our brains are wired to think about the strategies to advance. And so it's a practice. So I will tell you that I've been working in this for 8 years now, and I slip. I still slip. If I slip while we're speaking today, I'll let you know. I'll call it out. And I know Karan and Megan will help call it out for me too. So I count on that. So don't feel like we're all perfect at the get-go and at the outset. But really think about these strategies that we want to advance, because these patterns can really help us in our mindset of understanding how we're all so much more diverse as we age. So the first strategy is to advance what surrounds us shapes us. The environments and contexts in which we live really make a difference for our outcomes. And working in public health, we know that, right? That's what we work toward every day. The second strategy is around our collective responsibility, right? So the ability to see that we're interconnected, and those policies and supports for older people help them, the daughter of an older person who is serving as a caregiver. And it doesn't necessarily have to be the daughter, anybody, but also are taking care of their young children, right? How are we helping that person in the middle? And that's really important. We're all part of the community. And then finally, the third strategy is that problems can be solved. And it's the problem of ageism that can be solved, not the problem of aging. Note the difference there. It's really important that we're recognizing the problem of ageism, right? And we are a nation who looks at building those supports to solve problems, right? That's something that's kind of part of American culture. So think about those things. I want to kind of give you a couple examples here so that you're familiar with what happens. Is anybody on from Massachusetts? If you're familiar with some of the work with Age Strong Boston. We want to talk about the process of aging as building momentum. So when it came time to repainting the shuttles and refurbishing them for the senior shuttles, people who were part of the Age Strong Boston project, they had gone through some of the training here about how to frame your communication strategies. And they moved from a senior shuttle to transporting Boston's most experienced people. Who doesn't want to get on that bus? Think about how that impacts an older person. How does that impact maybe their family members or neighbors who see people getting on the shuttle? And think about how that in the community and the community of visitors to Boston, are seeing this all the time. And note that it doesn't say, hey, look, we're reframing aging, right? It simply demonstrates how we're talking about we are transporting people with experience, right? Here's another way to think about it: explaining the supports that we need to live meaningful lives as we age. And that's what's so great about the age-friendly ecosystem when you think about this. When we're talking about age-friendly community and age-friendly cities and age-friendly workplaces and age-friendly public health, age-friendly health systems, age-friendly education and research, all of that contributes to how we can advance policies and practices to give us those supports we need for all of us as we age. Because across the life course, we need these services and supports sometimes too, and we don't think about that because you're thinking about them as, oh, they're for others, they're for older adults, doesn't impact, right? So it helps us ensure that we all continue to work toward this, and it's really going to help us with how our communities, how our colleagues understand aging. The next piece I would talk about is think about something like curb cuts and how curb cuts started out in thinking about people who have disabilities needing the ability to go up the curb without a problem. But it's inspired by a person who was in a wheelchair. But really think about how it impacts mothers with strollers, the UPS person or the Amazon delivery person when they're trying to get things across. I think about when I'm riding my bike and I need to get up off the street, how that curb cut really helps us. Again, it's a support that we all need and we all benefit from. I want to show you an example of how we can advance a strategy to talk about aging and recognize frailty without paternalism. So this is something that we took from a news article. Many people who are older are frail, vulnerable, cannot help themselves, and depend on others to meet their most basic needs. This leaves them at risk for all kinds of challenges, potential harms, and scams. So I think we would all read this and say, okay, this is true. We know that there are scams, there are potential harms and challenges. But we're talking about older person as other. Remember, there's they and themselves and their and them. And then we're leading that a concept that older people are frail and vulnerable, right? All older people are frail and vulnerable. Here's how we can reframe this message that brings us all into this, right? When community bonds are weak, older people who are frail are more at risk for experiencing harm. We need to build solid connections and strengthen our social structure to better support older people, families, caregivers, and our entire community. Same concept, different strategy for how we communicate it, and recognize that we can all be part of this. We are all part of this this solution, right? And think about that in a way that we're not relying on a message that is not truly productive in what we know about aging and older people. So another strategy to advance, when I talked a little earlier about ageism as a problem that can be solved. Again, ageism rather than aging. Some people walk away and say, oh, they're talking about aging, and aging is not a problem. In fact, aging is something we all want to be doing, right? But talking about it, and here's some examples from Worthington, Ohio, and age-friendly Worthington, that they use signs that are posted in the community, really start to say, think about how ways that we're calling out references to aging that get us beyond that fatalistic thinking, right? So aging, so cool, everybody's doing it. Engage at every age, worthington.org/age friendly, and be thankful for the gift of age. So think about how that resonates within a community and recognizes that we're all aging, right? And that's really important, that these kinds of signs are up in the community in Ohio. One other thing that I particularly as the goals this year are advancing equity and how we think about equity in terms of the work that we do here at the National Center is, when we do this work, we take an intersectional and inclusive approach. When we do that, we recognize that we're good framing neighbors, right? And that means we don't compare isms, right? In our research, there's no way if we compare isms, we forget and we do not recognize intersectionality that occurs, right? How that really can and impact an older person really makes a difference. The other thing is that we miss an opportunity to really understand how equity works, right? And we want to define ageism and intersectionality for people. Again, like I did at the beginning of this session here today, we just want to level set for everyone, make sure we're all working from that same, how we're working from that same message or that same understanding, because most people don't think about this and most people don't know what we mean when we're talking about ageism and intersectionality. So it's really important that we don't want to leave it up to the reader or the person who's listening to fill in the blanks themselves. Remember that you say, they think, right? So we shouldn't assume that someone understands the definition the same way that you do. The other thing that we talk about quite often is our goal is to reframe rather than rebut. And what do I mean by that? In our language, in our communications, in what we write and how we speak, people will model that. Right? We don't want to go right up at somebody and rebut statements, because what starts to happen is you don't offer that opportunity for people to gain understanding. And we want to be able to have that dialogue. So rather than just going right up and, you're ageist, right? How do we reframe for people? People will talk to me about seniors all the time, and I will just repeat older people. And eventually, and like I've seen it in some scenarios where as someone starts to hear that, they really do start to change the way they approach talking about aging. So really important to think about. We have so many highly innovative and creative solutions, right? Those systemic solutions that we need to advance. And that's really when we talked about thinking how we can get people to think solution first, systemic solution first, rather than the statistics that drive people to say, I can't do anything about this. If we can do that, we can really help people see the possibilities. And that really helps us to be able to prompt that attitude of, we can do this, we can address this, and we can move forward to improve those policy services and supports that we need to advance for older people. I want to share with you that there's opportunity to learn from our partners. We have some case studies up on our website. After this call, don't feel like I didn't get everything down. After this call, I'll share with Karan and Megan a slide deck for you to be able to, the set of slides, a handout, and also some of these links and how you can find out about things. But you can find out about different communities and how people, how organizations and how different people in the community are starting to change the narrative, starting to change the discussion about aging in their own communities. I think the thing that's really important, and I hope you take this away from what we know about the research in reframing and what we know about the research in shifting how people think about any topic, but in particular here about aging and older people, is that as we increase knowledge, we are able to start to shift that conversation that contributes to people's improved attitudes about aging, which then, starts to really get us to that policy support, that growing policy support that we seek. So there are resources from the National Center to Reframe Aging. If you type in reframingaging.org/resources, you'd be able to get to those that include a quick start guide. Right, I talked about othering and how you can start to think about phrases that you can use. We have, if you've seen that you've used these phrases, try these phrases. We have a learning center that provides additional access to education around different ways to improve your communication strategies and apply some of these strategies that we talk about advancing. We have a newsletter that we publish every other month called Caravan, because we hope you're all going to join the movement and be on the caravan with us to improve how we talk about aging. In that newsletter, we share additional tips to think about that we get from our community who shares with us, I'm having this challenge. What do you suggest? We also share different activities that we know that are going on around the country and how you don't have to start from scratch. You could advance your work by borrowing from others and learning from others. And then again, the frame of mind videos that I think are really important to help advance some of the work. We do provide additional education and consultation and technical assistance for how you could advance your work. If you know of others who are trying to think about how can we advance this in our community, we'd be happy to talk to you about that. And I think ultimately, the thing I think that is most important is that we hope that at the end, you're starting now to see how you are able to contribute and advance in the community to frame aging. And what I'd ask you all to do right now is if you would take out your calendar or take out whatever device you use to mark how you want to participate or something that you need to do. So look in your calendar app and go to February 18th at 9 a.m., whatever time zone you're in. And I want you to ask the question in the subject line. I want you to type, what did I do this month to reframe aging? And you can make it a recurring, I suggested doing it February 18th, but you can make it a recurring appointment. And what you could do in your notes there is put some links to Reframing Aging, so reframingaging.org or reframingaging.org/resources, so that then you can start to think about this, because we hope that you'll all recognize that these positive perceptions about aging are truly priceless. So with that, I'm going to turn it back to Megan and Karan, and again, say thank you.
Appreciate it, Trish. Thank you so much. Yeah, I have to say, I think one of the first things that I did when I first started learning about ageism and how to communicate better is I printed out that quick start guide, and it is still on my whiteboard today. So it's something I refer to. I always learn something from you, Trish, and I really appreciate the slide on equity and how we can think about communicating better with an equity focus. And I think we can apply that to more than just thinking about the older adult population, but other populations as well. So thank you so much. Wonderful resources. We have a few minutes. If anyone has a question for Trish, you have a wealth of information right here at your fingertips for the next few minutes. So I highly recommend you take advantage of that. And I do also want to say, while you all are thinking of a question or something that you want to just comment on, is that Trish has also provided a training for the TIFA staff on ageism, an initial training, and everyone has found that really valuable. And Trish, we hope that we can have you back for round 2. We'll see if we can make that happen. Yeah. But while we're waiting, any questions or comments? Lots of new names here today, so we're really happy that you all have joined us.
I'm trying to go through the chat.
So I guess, Trish, just to help folks kind of get started, if someone comes up to to one of our attendees here and has a joke, that's clearly ageist, what's a way to respond to that?
Good question. So what I think is really important is, again, remember, reframe, don't rebut. So the one thing we want to avoid is making sure we don't embarrass someone in front of, like, think about where you are and what you're, and so some of this is situation dependent, how well you know the
Mhm.
person, really good friend versus somebody you just met, things like that. And I think what we really try to encourage is asking somebody, gee, what made you, it's an interesting way to think about aging. What made you think that way? Like, probe a little bit and ask some questions, rather than just you're ageist, stop that. But I think at times in certain groups, it's okay to say, well, I don't really like jokes like that, and here's why. So,
Mhm.
or I tend to refrain from telling jokes like that, and here's why. And that's kind of an important piece. And the here's why is, do we fully understand what we're saying when we do this? And particularly as as I'm moving into the age group that we start to talk about. So I turned 60 this year. When we start to think about that, letting other people know, well, do you think of everybody sitting here as that type of joke that you've just told? I think one of the pieces that I shared with in other calls here is a couple years ago, there was an ad company, like an ad award for somebody that wrote an ad that had 4 white men and 1 white woman who talked about, that's okay, millennials don't vote because seniors vote and we get what we want. Well, first of all, we know that that's not true, right? Because if you looked at how the Older Americans Act is funded, we certainly
Mhm.
not supporting aging. Secondly, we also know that that doesn't really describe how most older people think about aging and think about an intergenerational activity. I had a family member who was younger who went out and started, tweeting about this and how it was such a, yeah, millennials, we got to make sure we vote. This is horrible. Older people are like this. And when I talked to them directly and said, you know what I do? So it was a family member. I said, you know what I do for a living, right? I mean, I started that way. I didn't start with how dare you tweet this. And then I also started to ask her to think about her grandparents. And did she believe that her grandparents thought this way? And when she started to hear that, her new social media messages were around, that's not how older people think, and we shouldn't be paying attention to this. So it really did make a difference to sit calmly and have that discussion,
Mhm.
rather than just say, I can't believe you posted that ageist statement.
Right.
You really do have to reframe rather than rebut. And now I will tell you that not only um, my niece, but my nephews are also very attentive to, and they're all between 20 and 30 years old. They're all very attentive to how we think about aging and recognize that we're all aging
Mhm.
through that
That's
example.
great. Yeah. It's good when we can start with our families. So
Yeah.
one final question. So when we're discussing with multiple generations, what guidance do you have when talking about references made about different generations? Because there are so many stereotypes. And I think maybe that is that situation specific, and kind of
Oh,
thinking
okay.
about.
I wasn't sure. I wasn't sure. So like when you mean when people start to say, oh, boomers and oh, millennials and oh,
Yeah. Yeah.
I think the one thing is we all have to remember that those were created for how advertisers started to describe people. So this was not created for how we, from a research perspective of how we think about aging. And there's a lot of things that mix here. I think the one thing that we should remember is sometimes when people use the term boomers, they don't realize who they're talking about. Also, when
Mhm.
people are talking about millennials, I don't think people realize that millennials have turned 40 and are older than the age of 40. And so millennials gets termed for like teenagers, 20-year-olds, and really like starting to explain like, well, can you talk a little bit more about who you're talking about or what you're trying to advance? Certainly in our work in thinking about how we want to advance thoughts about, we just don't use those terms. We recommend you be very specific. If you mean a population of people age 18 to 25, state that. Don't just say teenagers, 20 somethings, things like that. Be respectful and state it. And kind of like the example I said earlier about, we don't just say all people over the age of 65. We really watch about that because we're talking about different cohorts. And we know that 65-year-olds and 85-year-olds we all have things in common, just like we have things in common with 32-year-olds. And that intergenerational work is so important. There's a lot of research
Absolutely.
about that I'd be happy to share sometime.
Yes, we are not all homogenous. Those of us who
Correct.
are over 65. So appreciate that. Trish, thank you so much. This is
Thank you.
phenomenal. So much great information. Karan, I'm going to turn it back to you for a couple final words.
Thank you, Megan, and thank you everyone again for attending, Trish. It is always a pleasure to have you. And again, we always learn something new. Just to close this out, our February training will be on February 15th at 3 p.m. You can register for this on our website, afphs.org, under events. And if you are pursuing our AFPHS Champion Recognition designation, please pause the video now to account for the fact that you've attended this, or if you're attending it live, you also want to capture this, that you attended the training. So please either use a QR code to note that you've attended this training, or if you're viewing the recording of it, you can navigate to that URL, or again, pause it and use that QR code to navigate and note that you have attended this training. I'll give you a few more seconds. And again, this is for those that are pursuing becoming an AFPHS champion. And again, thank you all so much for joining us today. We look forward to seeing you on our next training.
Thanks, everyone.